with me being a runner my whole life, I started, in the ninth grade in 1973, and, was a collegiate runner on scholarship and was an all-state high school runner. And I even ran after I graduated from college. And then coaching allows me to continue to run, as part of my job, really be out there with the guys.
I first met Coach Braman to do what's called a stress echocardiogram, one of the diagnostic studies that incorporates an exercise test with ultrasound imaging of the heart. And he told me about this 6 to maybe 8 month history of inconsistent discomfort in the chest and throat. Actually, there had been some concern that it may be gastroesophageal, which is a not uncommon circumstance in our business. The stress echo was abnormal kind of on all 3 counts. He had his discomfort, he had an abnormal EKG response, and then he had what we call a wall motion abnormality, an area of the heart that clearly was not happy under stress, under exercise.
Yeah, it was a big surprise. Dr. Gredler, who's been through this a lot of years, was very, very suspicious because of some of my symptoms, where, as some of the younger lab techs that were there learning and watching as I was for the first time, oh, Coach, you're probably fine, it's probably, nothing. But as the treadmill test went on and we got up to 160, which is about my maximum beats per minute, I was working like a freight train, and, immediately get off the table, do the sonogram of the heart, and then we looked at those pictures, and as he suspected, they came right up.
And what you can imagine is the perception of, obviously, the lion's share of people who would look at Bob Braman is, here's a man who is in excellent physical condition. It's what he does every single day. How could it possibly be that he's got coronary disease? It is one of the sort of clear realities of our business is that, thankfully, people hopefully pay attention to symptoms, and we get an opportunity to pursue them and find what we're dealing with before something more difficult or potentially distinctly tragic happens.
So it went very, very smoothly. I was glad that, the doctor that diagnosed me that I had confidence in was the guy working on me, and that he had confidence in the doctor that came in and put the stent in. So I never had any second thoughts about it, and it went really well, very quickly, was out and, well taken care of. I was kept overnight just as a precaution, and then the next morning, first thing in the morning, I'm meeting with Dr. Gredler. We're looking at the artery and how pinched off it was and the whole 9 yards.
There's no question in my mind that the wealth of experience, the facilities available, the expertise of colleagues, both in my practice and elsewhere, would make it a very, very easy decision in terms of where I would recommend my patients have their care.
Yeah, I mean, my procedure went so well, and the experience was so great and fantastic and smooth, that if somebody asked me, I would absolutely recommend TMH for their procedure. And the confidence that I've had beforehand and afterwards and the follow-up has been really, really fantastic. And so anybody that was considering it, I'd say, hey, stay here in Tallahassee, go to TMH, get the best doctors available, and it'll be a very, very smooth and quick procedure. You're in and out in less than 24 hours, and you're back to your routine, and very little apprehension about where you go from here. You feel like you're not only healed, if you will, but I feel way better than I did before because I'm getting more oxygen to my heart.